Okay, in this video, we're going to talk about some postpartum changes. So, how do bodies change after birth? How does a body change after birth? There's a lot. So, if we consider that birth is potentially a traumatic experience for both the newborn and the birthing parent, there's a lot to consider in what happens. There's a giant change that happens after birth. Some of those changes are physical, relating to the actual skin tone, stretch marks. Some is with feeding. Okay, there's a lot to talk about. First, stretch marks. Not all stretch marks look the same. Many will thin to sort of whitish lines, but some are thicker and deeper. All stretch marks result from a tear to the dermis from growth, rapid growth that occurs during pregnancy. These can occur in the abdomen, but also in the breast, in the thighs, in the buttocks, a lot of different areas. And many times they fade, but rarely do they completely go away. Perineal soreness. So the perineum is the area between the vagina and the rectum or anus. It stretches and may tear during labor and vaginal birth. If a person has an episiotomy, there was actually a cut. So it's often sore after giving birth. And it may even be sore if you've had an episiotomy, that cut. So, although many people dispute whether or not the cut is necessary, regardless if you have had the cut or if you have had tearing, there may be increased perineal soreness. This squeeze bottle, which in most hospital births is going to be given to you, filling it with warm water to help ease that perineal soreness during urination and defecation. So wiping is even worse. Okay, so this can help with some of that soreness. Okay, pain. The afterbirth pains are cramps felt as the uterus is contracting back to its pre-pregnant size. The cramps should go away in a few days, although it may persist a little bit longer. Right after giving birth, the uterus is round, it's hard, it weighs about 2.5 pounds. In 6 weeks, it's only going to be about 2 ounces. Okay, so there's a lot of things happening in the uterus. Lochia. So this is the discharge that is coming through the vaginal canal. It includes blood and tissue that was inside the uterus, so we can have clots, can have clumps. For the first few days, it's typically bright red and contains a lot of clots. Over time, the flow lessens and gets lighter in color. Lochia may last for a few weeks or even for a month or more post-delivery. So a normal period does not last that long. Lochia is going to last much longer. Okay. Someone who chest feeds, chest feeding will cause contraction of the uterus, and it may help that bleeding, the lochia, stop sooner. May help the uterus shrink back down into its pre-pregnant size sooner as well. Okay, perineal cold packs can help. So this has an absorbent pad for lochia, but also has, those like quick cold pack. You kind of pop it. Well, it has that, which just that coolness is an additional alleviation of both the perineal pain and what I'm going to talk about on the next slide, which is hemorrhoids. So hemorrhoids, painful swollen veins in and around the anus. They may hurt, they may bleed. Hemorrhoids are super common during and after pregnancy. Remember that pressure of pushing is very similar to pushing out a bowel movement. It's the same type of pressure that's created, so it can result in hemorrhoids. There are some options for hemorrhoid relief. One, the perineal pads, which may kind of assist both, but also there are many variations of cooling pads to help with that hemorrhoid relief. Constipation. So Constipation means not having bowel movements, having infrequent bowel movements, having stool that is hard to pass, so requiring a great deal of pushing. May result in painful gas, and this can happen for a few days after birth. So remember, the body just went through a traumatic process of birth, and a lot of things need some time to adjust. Okay, many birthing parents take medication for constipation. Folase is the name brand, but there are a lot of generic versions of it. So your doctor, your midwife, your medical professional may suggest taking it to alleviate constipation. Also, due to tearing or episiotomy or hemorrhoids or just perineal pain in general from giving birth, many birthing parents sort of have a fear about the first bowel movement after delivery. So taking something like this, a stool softener, can help to perhaps alleviate some of that mental stress related to it, which may only contribute to increasing constipation even further if that is not relieved. Okay. There can be urinary problems. So you might have pain or burning urine during urination. So remember that squeeze bottle I showed you that you fill with warm water? Using that while urinating can help to alleviate some of that stinging pain. You may feel unable to urinate, and that may be due to some swelling during the birthing process. You may be unable to stop urine flow or have incontinence, so not able to stop yourself from urinating. So feeling like you have to go and then being unable to stop it. Some of this resolves with some pelvic floor exercises. Talk to your doctor if there's something that is concerning. Exhaustion. So during labor and birth, first of all, you lose blood. Second of all, labor and birth is hard work. And then babies affect sleep. So remember, they're only sleeping in 2 to 3 hour bursts. So this really disrupts sleep. And what about mood changes? Well, there are varying levels of this, so let's talk about it. First would be the baby blues. So due to a sudden drop in estrogen and progesterone after birth, it's about 80% of birthing parents feeling things like sadness, anxiety, difficulty sleeping. Usually occurs within a few days after birth, and it can last about 2 weeks. This is normal. That does not in any way minimize what someone going through the baby blues experiences, because it is real, it is powerful, okay? But it is also a completely normal experience. So having a support system, people around, is important. But sometimes it's more serious than the baby blues. Postpartum depression is about 10 to 25% of birthing parents. So less, but this is still common. This is when the baby blues last beyond 2 weeks. And it can begin anytime in the baby's first year. So although the baby blues begin typically a few days after birth, postpartum depression can occur when the baby is 6 months old or 9 months old. Okay, unrelated to birth. Aside from that, it's in the first year. Postpartum depression is more serious. There's depression, crying spells, irritability, anxiety, insomnia, exhaustion, hopelessness, guilt, feeling worthless, a lot of changes in sleep and appetite. Okay, so this is more serious and it tends to last longer. Okay. So statistics, less than 15% of birthing parents will receive treatment. 1 in 7 will experience depression during pregnancy, and the rates of depression are more than doubled for people of color. Okay, all things that should be alarming and make people realize the seriousness of postpartum depression. So again, if it lasts beyond 2 weeks, if it shows up when the baby's 8 months old, okay, again, if it's progressing past 2 weeks, more serious symptoms, we are thinking postpartum depression versus baby blues. But again, speak to a medical professional, okay? Sometimes it's even more serious than postpartum depression. So postpartum psychosis. it's about 1 to 2 cases per 1,000 births. So this is far less common, but still significant enough. It usually occurs in the first month, although not 100%. But what is different about this is it usually occurs rapidly. It may occur within hours or over weeks, and it results in more serious mental instability like mood swings, paranoia, hallucinations, and it is absolutely 100% an emergency. If you've heard about, this is Andrea Yates, who drowned her children in the bathtub, suffering from postpartum psychosis. Okay. It is an emergency, it is serious, and it is not something to ignore in a birthing parent who may be experiencing these symptoms. So having a support system is important. Birthing parents require care. Babies require care. So they need to be given human milk, they need to be given formula, just as the basic needs, but there's a whole lot that goes into caring for babies aside from feeding them, changing them, holding them, finding out what is needed to comfort them when they're crying. But chest feeding, pumping, and formula feeding are ways to feed babies. They all take time. And for someone who might be going through baby blues, postpartum depression, or even more serious postpartum psychosis, these tasks can become overwhelming. So a support system is important. These are some of the postpartum changes and talking about how bodies change after birth. And I hope that you learned something new today.